Welcome to the first section of your AHIMA CCA exam preparation course, where we will build your foundation in health records, data content, and information technology. In this lesson, you will learn exactly how medical records are created, structured, and securely maintained in modern healthcare settings. This topic is incredibly important because before you can assign any medical codes, you must completely understand the environment where clinical data lives and breathes. I am thrilled to guide you through these core concepts. From the basics of patient data to the software systems you will use every single day. Get ready to dive in, because mastering this information is your very first step toward passing the certification exam and launching a successful career in health information management. At the absolute center of the healthcare system is the health record, which is the primary source document for all medical coding. A health record is simply a systematic collection of information about a single patient and the medical care they have received. Think of it as a detailed storybook of a person's medical history, containing everything from their vital signs to complex surgical reports. As a future coder, this record is your daily workspace, and your job is to read this story and translate it into standardized codes. Understanding what belongs in this record is the key to finding the right information quickly and accurately during your exam and in your real-world career. One of the most common ways a health record is organized is called the source-oriented format. In a source-oriented health record, documents are grouped together based on the hospital department that created them. For example, all the laboratory results are kept in one section. All the nursing notes are in another section. And all the physician progress notes are kept together. This method makes it very easy for specific departments to find their own past entries. But it can make it slightly harder to see the overall timeline of a patient's illness. For your exam, remember that source-oriented records organize data strictly by the origin of the information. Another important organization method you will encounter on the exam is the problem-oriented medical record. Instead of organizing documents by the department, this method organizes the patient's information around their specific medical problems. The record includes a master problem list, which acts like a table of contents for the patient's current and past health issues. Every note, treatment, and test result is directly linked to one of the numbered problems on that list. This setup makes it incredibly easy for healthcare providers to track the progress of a specific disease. And it helps coders easily link treatments to specific diagnoses. Within the problem-oriented record, providers often write their daily progress notes using a specific format called the SOAP note. SOAP is an acronym that stands for subjective, objective, assessment, and plan. The subjective section includes what the patient tells the doctor, like explaining that their stomach hurts. The objective section contains measurable facts, like a patient's temperature or their blood pressure reading. The assessment is the doctor's official medical diagnosis, and the plan outlines the treatment or medications prescribed. As a coder, you will constantly read SOAP notes to find the correct diagnoses and procedures to code. Before a medical record can be coded, it must be complete. Which brings us to the concept of quantitative analysis. Quantitative analysis is a detailed review of the health record to make sure there are no missing reports, signatures, or important patient information. Think of it as a very strict checklist to ensure every required piece of paper or electronic form is present and properly signed by the physician. If a discharge summary is missing its final signature, the record is considered incomplete and often cannot be fully processed for hospital billing. You might see exam questions asking you to identify this specific type of record review, while quantitative analysis looks for missing pieces. Qualitative analysis focuses on the actual quality and accuracy of the documentation. Qualitative analysis involves reading the medical record to ensure the care provided meets established standards and that the written documentation makes logical sense. For instance, if a patient is admitted for a broken leg, but the doctor only writes notes about a headache, a qualitative analysis would flag this major inconsistency. Coders perform a mini version of this every day, checking if the physician's documented diagnosis is supported by the lab results and treatment plan. Your exam will test your ability to tell the difference between quantitative and qualitative reviews. Today, most hospitals and clinics have moved away from paper folders and now use an electronic health record, commonly known as an AHIMA. An electronic health record is a real-time, digital version of a patient's paper chart that is available instantly and securely to authorized users. The AHIMA allows doctors, nurses, and coders to access the same patient file at the exact same time from entirely different computers. This modern technology reduces physical storage space, prevents handwriting errors, and significantly speeds up the coding and billing process. You must be very familiar with the purpose and benefits of electronic health records for your certification exam. You should also understand the concept of a personal health record, or PHR. Unlike an electronic health record, which is owned and managed by the hospital or doctor, a personal health record is controlled and maintained entirely by the patient. The patient can manually enter their own blood sugar readings, exercise habits, or over-the-counter medications into a mobile app or secure website, while doctors can sometimes view this information if the patient allows it. The PHR is designed to empower individuals to manage their own health journey. The exam often tests your knowledge of who actually owns and controls these different types of health records. As medical records become completely digital, the concept of data integrity becomes absolutely critical in health information technology. Data integrity simply means that the health data is complete, accurate, consistent, and has not been altered or destroyed in an unauthorized way. If a nurse accidentally types that a patient weighs 200 kilograms instead of 200 pounds, the data integrity has been compromised, which could lead to a dangerous medication overdose. Ensuring data integrity means having strong computer systems that check for unusual entries and protect against human error. Coders rely on high data integrity to ensure the codes they assign are completely accurate and safe. Once you actually begin coding, the most important software tool you will use is called an encoder. An encoder is a specialized computer program that helps medical coders navigate through the complex rules and guidelines of clinical classification systems. Instead of flipping through thousands of pages in a heavy physical book, the coder types a keyword into the encoder, and the software suggests the correct codes and displays relevant coding rules. Encoders significantly improve coding speed and accuracy by prompting the coder to ask the right questions about the diagnosis or procedure. Familiarity with the basic function of an encoder is a guaranteed topic on your certification test. Taking technology a step further. The healthcare industry is increasingly relying on computer-assisted coding, commonly called CAC. Computer-assisted coding uses powerful artificial intelligence to automatically read the physician's electronic notes. The software scans the document for medical terms and automatically suggests a list of codes for the human coder to review and approve. It is very important to remember that CAC does not replace the coder, but rather acts as an incredibly smart assistant that makes the coder's job faster and helps prevent missed codes. Your exam will expect you to understand how CAC supports, rather than replaces, human expertise. To truly understand computer-assisted coding, you need to understand the underlying technology behind it, which is called natural language processing. Natural language processing, or NLP, is the ability of a computer program to understand human speech exactly as it is spoken or written. In healthcare, NLP allows computers to read complex, messy physician notes and extract meaningful medical data like diseases, medications, and surgical procedures. Without NLP, computers could only understand simple checkboxes or drop-down menus. This technology bridges the gap between how doctors naturally write and the strict, standardized language required for medical coding. Because accurate coding depends entirely on accurate physician notes, hospitals utilize clinical documentation improvement programs, known as CDI. The goal of a CDI program is to ensure that the health record accurately reflects the true sickness of the patient and the full scope of medical services provided. CDI specialists review records while the patient is still in the hospital and send polite questions to doctors if the documentation is vague or missing important details. For example, if a doctor writes heart failure, the CDI specialist might ask the doctor to clarify exactly what type of heart failure it is. High-quality documentation leads directly to highly accurate coding and appropriate reimbursement. The specific tool used by CDI specialists and coders to clarify documentation is the physician query. A physician query is a formal, written communication sent to a healthcare provider asking them to clarify confusing or incomplete information in the medical record. It is extremely important that queries are never written in a way that leads the doctor to a specific answer that pays the hospital more money. Instead, queries must be neutral, provide the clinical evidence found in the chart, and offer the doctor multiple choices, including an option for other or unable to determine. The exam tests heavily on the ethical and compliant way to write a physician query. Every hospital relies on a massive organizational database called the Master Patient Index, or MPI. The Master Patient Index is a permanent registry that contains demographic information for every single patient who has ever received care at that specific facility. It acts as the ultimate reference tool to ensure that when a patient arrives at the emergency room, their new visit is correctly linked to their previous records. A duplicate patient record in the MPI can lead to dangerous medical mistakes. So maintaining a clean and accurate index is a major priority for health information departments. As technology advances, hospitals need to share patient information with other facilities, which is done through a health information exchange, or HI. A health information exchange is an electronic network that allows different doctors, hospitals, and clinics to securely share a patient's medical information with one another. If a patient from New York gets into a car accident while on vacation in Florida, the AHIMA allows the Florida emergency room doctors to instantly view the patient's medical history, prior surgeries, and severe allergies. This seamless sharing of data improves patient safety, prevents duplicate testing, and is a vital component of modern healthcare. Even with widespread electronic sharing, patients frequently request copies of their own medical records through a process called release of information, or ROI. The release of information process is highly regulated and ensures that a patient's confidential health data is only given to authorized individuals. Health information professionals must carefully check written authorization to ensure they are valid, signed by the patient, and specify exactly what information can be released. Providing too much information, or giving it to the wrong person, is a severe violation of privacy laws, making ROI a critical function that you must deeply understand for your exam. Finally, medical records cannot be kept forever. So healthcare facilities must follow strict record retention and destruction policies. Record retention refers to the specific amount of time a hospital is legally required to keep a patient's file, which varies widely based on state laws and whether the patient is an adult or a minor child. Once a record has passed its legally required retention period, it must be destroyed using highly secure methods, such as shredding paper documents or completely wiping electronic hard drives. Your exam will test your understanding of the entire life cycle of a health record, from its creation all the way to its legal destruction. Congratulations on successfully completing the first section of this course. You have taken a massive step toward understanding the complex systems, strict regulations, and advanced technologies that support the entire medical coding profession. Now, I highly encourage you to complete the attached practice test for this specific section. Completing practice questions is proven to dramatically improve your long-term memory retention and is the absolute best way to gauge your actual exam readiness. The practice test is included directly with this lesson, so take advantage of it right now to reinforce your active learning. Once you feel confident with this material, I will see you in the next section where we will begin exploring the fascinating world of clinical classification systems.